Concussion pathophysiology for a parent, athlete, or coach. So concussion is a brain injury that can result from a direct or indirect blow to the head or body. There's often a misconception that you must lose consciousness to have a concussion. Normally, your cells send signals to your brain to complete tasks, and when there's an injury, the cells are stretched so the signals cannot get sent effectively. There's an increased need for energy in those cells after injury, and you're depleted of that. Once those cells are injured, you're at a higher risk of re-injury if play continues. However, most patients recover within 10 to 14 days of injury. Concussion pathophysiology for physicians. When there's a direct or indirect blow to the head, the neurons are stretched. Once these cells are stretched, the neurotransmitters cannot be sent along smoothly. There's a release of potassium and an influx of calcium ions. This exchange is accompanied by an increase in the need for glycolysis and an increased need for energy and decreased cerebral blood flow. Potassium levels are rapidly increased and usually restore within 12 minutes of influx. Calcium levels also have a large increase but take about 6 days to go back to normal levels. There's also an increase in glucose and glutamate. Glucose levels return to normal within 20 minutes but then go below normal levels. They then return back to normal about 6 days later. The average recovery time for concussion is around 7 to 10 days to allow for the restoration of all of these ions.